Diabetes Connections is brought to you by One Touch. Every touch is a step forward. By Dexcom. Take control of your diabetes and live life to the fullest with Dexcom. And by Real Good Foods. Real food you feel good about eating.
This is Diabetes Connections with Stacey Sims.
This week, our first interview with Insulet, the makers of Omnipod. CEO Shacey Petrovic shares the latest on Dash, Horizon, Loop, and more.
One of the things we've done, for example, is maintain multiple set points so that people can have the flexibility to target specific ranges or specific blood glucose targets that they're looking for depending on the circumstance.
Shacey also shares her personal connection to type 1. Her dad lives with it. And we talk about what it's like to be an adult helping your parent manage diabetes. A very different dynamic than the parent, me, helping their child. In our community connection this week, some announcements from the AADE Conference. And in Tell Me Something Good, an honor for a school, thanks to a big gesture from a student. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome back to another week of Diabetes Connections. I'm your host, Stacey Sims. Really glad to have you all along here. Lots of information coming up in the show today. But first, we aim to educate and inspire about type 1 diabetes by sharing stories of connection. My son was diagnosed with type 1 diabetes right before he turned 2 back in 2006. He is now 14 and heading into high school. Yes, it is back to school. As you're listening to this, my son Benny has about a week left before he heads into his freshman year. But we are today, as this episode is being released, bringing my daughter to college. Yeah, if you're a longtime listener, you know that my daughter Leah graduated from high school this year. And yep, here we go. We are taking her away to school. So very excited about this for her. Excited for us too. But man, this is a big transition. So a lot going on in my house, to say the least. I'm going to be linking up some back to school episodes. We've done a bunch in the past, everything from elementary school, middle school, college, even some information on daycare and preschool. There's a lot of information out there. So I'll be linking up the episodes that we have done on the Facebook page, on social media, in the group, that sort of thing, and putting a little bit of information in the show notes for this episode. The American Diabetes Association's Safe at School website is really chock full of information. So if you're not sure, you're wondering, what is a 504, or what do I put into it, or can I get that for a private school, or what do I do for college, and what about accommodations? Whew, we'll put all the information you need into the show notes and get you started. Diabetes Connections is brought to you by Dexcom, and we have been using the Dexcom G6 since it came out more than a year ago. It is amazing. The Dexcom G6 is now FDA permitted for no finger sticks for calibration and diabetes treatment decisions. You do that 2-hour warm up and the number just pops up. I'm still getting used to that. It really does seem like magic to me. We've been using a Dexcom for almost 6 years now, and it just keeps getting better. The G6 has longer sensor wear, now 10 days, and the new sensor applicator is so easy to use. Benny does it himself now. He says it doesn't hurt at all. Of course, we still love the alerts and alarms, and that we can set them how we want. If your glucose alerts and readings from the G6 do not match symptoms or expectations, use a blood glucose meter to make diabetes treatment decisions. To learn more, go to diabetes-connections.com and click on the Dexcom logo. My guest this week is the CEO of Insulet, Shacey Petrovic. I have been trying to set this up for a long time now. I'm really thankful and I really appreciate that she took some time to come on the show and talk to us about the latest and the yet to come with Insulet. Now, this interview was conducted just before an earnings call. If you follow these things closely, you probably have read all about the earnings call, and I will link up information from that in the show notes as well. Nothing materially different that I could see. Maybe you'll find it in the fine print in that call. But as many of you in the Facebook group know, I asked you for questions because we are not an Omnipod family and there are intricacies and ways to use that we do not know. So I was thrilled that so many listeners asked questions. You'll hear Shacey's pretty impressed by you all as well. And while we have sponsors here on the show and I have relationships with certain companies and Benny uses certain diabetes tech, my hope here, and you know this if you've listened for a long time, is that we will talk to everybody, because my position for this podcast is that you as the listener come first. That's what I'm here to do. I'm here to provide you information. And if we can talk to all of the tech companies and really have some great conversations, I think it just benefits everybody in the long run. So here is my interview with Shacey Petrovic. Shacey, welcome to Diabetes Connections. Thanks for spending some time with me. I really appreciate it. I'm excited to learn more.
Great. I'm thrilled to be here with you, Stacey, for the first time.
Yeah. All right. So, let's talk. There's so much going on with Insulet right now. I kind of want to go as much as I can step by step, but we'll probably jump all over the place. But let's start with Dash. How is the rollout of Dash going now? And then could you explain what Dash is?
Sure. Maybe I'll start there with what exactly Dash is. Omnipod Dash is our next generation PDM and mobile platform. So if you're familiar with the Omnipod system, Omnipod is comprised of a small, discrete wearable patch pump called Omnipod, and it's controlled by a handheld controller called the Personal Diabetes Manager, or PDM. So with this next generation system, we have launched a new PDM, and it's a very slick, sort of modern touchscreen PDM with Bluetooth communication. And then the pod has remained the same, but has been updated with Bluetooth communication. And then the system comes with a suite of mobile apps that enable the user to invite followers or view their Omnipod data and their CGM data on their mobile phone in one spot. So we entered into full market release with Omnipod Dash just recently this year, and the feedback has been really terrific, I think, and really enthusiastic. Customers have told us, how much they love how intuitive and modern the PDM interface is. It is really like a modern smartphone experience, but it's your PDM. For many of our customers, discretion is very important. So people like that the Dash PDM doesn't look like a medical device. It really looks like a small cell phone. And I think customers also see this as a really important step forward on our future vision that people will be able to, download an app on their mobile phone and be able to securely control their pods. And then I guess the last thing I'll say, actually, which is one of the more important things, is one of the most exciting and innovative things about Dash is the business model. With Dash, we have eliminated the upfront cost of the PDM. So the Dash PDM comes free with the purchase of pods, and we did that to remove barriers for adoption and help more people get access to and try the technology.
I've been trying to read reviews and talk to people who have been using Dash, and the one thing that does come up a couple times is that this seems sort of like a next step, but not a finished step, in that, I'll be honest with you, I've been told that the new PDM already feels old-fashioned. People, as you've already said, they want to use their smartphones to control the pods, and the device kind of feels clunky. Can you talk a little bit about this? I guess it's temporary, right? This is not the end design.
Well, no, this is Omnipod Dash, and I don't think anyone has described Omnipod Dash as clunky. I think they're probably referring to the previous generation of the technology. Dash itself is actually really small and really cool, really slick and modern. But it is one step towards our final vision of people being able to control their pods with just their mobile phones. And Dash was designed actually as an app on a mobile phone. So it is a small Android mobile phone that is locked down as your PDM, and it is Dash, the user interface. It's designed as an app on a phone. So our next generation product, which will be out next year, is Omnipod Horizon. And Omnipod Horizon is an automated insulin delivery hybrid closed loop system that will offer phone control. So you will be able to control your pod and your system from an app on your mobile phone.
Great. And just to be clear, and people who listen to the podcast know, we use a different pump system. And to be impartial here, and again, this is our first time talking, Shacey, these are not my thoughts. I'm actually reading from the Healthline DiabetesMine Omnipod Dash First Impressions.
Okay.
So these are not things that I'm making up. I'm reading and I'm giving you feedback from actual Dash users. But I guess my question meant to be, and you started talking about Horizon, which is great. When I said it's kind of like the next step, it's the done Dash, but the next step is Horizon.
That's right. Yep.
So when Horizon comes out, Dash won't still be in use, will it? Or am I confused?
No, I think there may be people who still opt to use Dash. Just like any other technology company in this space, most of us have multiple generations of technology available on the market. And so there may be people who continue to use Dash. But I do think Horizon is one of the most anticipated technologies coming to the diabetes community. And so there will be great demand. And I do think the vast majority of our customers will want to convert to Omnipod Horizon.
Yeah, I mean, I just think it's so exciting to see what's happening with technology and the closed loop systems that are coming. So let's talk a little bit more. I know it's well in the future and you can't talk timelines, but talk to us a little bit more about Horizon. How will it work? Is it going to be with Dexcom G6? Do you jump ahead to the G7? Can you share any of that with us?
Sure. So Horizon is our hybrid closed-loop automated insulin delivery system. So we're currently in late-stage clinical and product development and making great progress there. And our focus with Horizon has been to provide unparalleled ease of use and glycemic control. And we do that in two ways. One, with the fact that it's an on-body hybrid closed loop. So the algorithm actually resides on the pod. And really the patient is wearing the Dexcom and the pod as they normally do, and they don't need additional things to control the system. And then it also offers, as I mentioned earlier, personal smartphone control. So the first generation of the system will be controlled by a secure mobile app on an Android device, an Android phone, and next generations will come with iOS phone control. But all the independent market research has indicated this will be a game changer. With phone control, we can eliminate a component of the system. And with our partnership with Dexcom, we have a great sensor, and the user experience will be terrific. The partnership today is with G6. But the great thing about iCGM and some of these pathways that the agency is laying out is that it should be a relatively straightforward process to upgrade to future generations of the sensor. And I think you'd asked kind of how it compares to other systems out there. I really think there are probably just three things that make Horizon really special. The fact that the algorithm resides on the pod and that the CGM speaks directly to the pod means that users will be able to always stay in closed loop, even when they're taking a shower or going for a run. And so more time in loop should mean better time in range. And then obviously phone control is a game changer. That is like the number one thing that our customers ask for. And for us, we're really excited to bring it to them next year.
Okay, so let's talk timelines then. So the idea here is that if all goes well, Horizon would launch sometime next year and would launch with smartphone control, no more PDM?
That's right. So it will launch in the second half of next year. That's currently the timeline. And it will launch with phone control. We will provide a backup PDM because there may be users who don't want to use an Android device. So everyone will have access to the technology while we're working to get all phones capable of smartphone control of the pod. But it will launch with phone control.
Can you talk a little bit about the algorithm at all? We're seeing things from Tandem and from Medtronic, where the example I'll give is, with Basal IQ with Tandem, the number is 80. If you go below 80, then the system really kicks in and tries to keep you above 80. Can you share any specifics like that with Horizon in terms of range? Right back to Shacey in just a moment. But first, Diabetes Connections is brought to you by One Touch. Have you ever tested your blood sugar with a meter and were unsure about the meaning of your result? Take the guesswork out of your numbers with the One Touch Vario Flex meter. It uses color short technology to instantly show you when your or your loved one's blood sugar numbers are low, indicated by blue, in range green, or high red, so you can quickly get on with your life. You can also use the meter's built-in Bluetooth smart technology to seamlessly sync with the One Touch Reveal mobile app, available now as a free download for Android devices on Google Play and Apple devices on the App Store. One Touch, because taking a step forward starts with seeing where you are. Now back to my interview with Shacey Petrovic, and she's answering my question about setting the range on the upcoming Horizon system.
Sure. I'll say that our goal with Horizon, and probably the third thing that makes it really, really special, is just that we've been so focused on making sure that it's the easiest to use, most intuitive system on the market. So that means we want a system that can be used by pump naive or multiple daily injection users. We want a system that can be used by kids. And so we have done a few things to that end. We've made the user interface as simple and seamless as possible. And we've also made the system as flexible as possible. One of the things we've done, for example, is maintain multiple set points so that people can have the flexibility to target specific ranges or specific blood glucose targets that they're looking for depending on the circumstance. So we won't limit you to 120 or 80. The system is always operating, and you will have multiple set points that you can target.
I don't know how much detail you can share with us, but if you have multiple set points, these are things that the user can set and change. This is not something that has to be factory set. You have to get a prescription for that kind of thing. You just set it yourself once you get the system home.
That's right. And Stacey, as a parent who's raised a child with diabetes, you might want to target a higher set point in certain circumstances, and you may want to target a lower set point in times of exercise or other circumstances. The user will have that flexibility with our system, and the algorithm adjusts accordingly.
That's great. That is really important. I'm glad to see that being considered. So let me ask you a couple of questions I got from my listeners. These are all folks who use Omnipod. I was really glad that people wanted to jump in and ask these questions because, again, we don't use the system. But the first question that came up, this is really something that we hear, especially with Dexcom too. Douglas wrote in, we've seen the issue with Dexcom getting approved and funding within Medicare. They're waiting for the rollout of G6 for Medicare, which you've been told is a supply issue. The question Dennis asks is, will Medicare patients be second-class citizens in getting approved for use? I don't want to have the same issues here as we've seen with Dexcom not being up to full production. Any thoughts on Medicare and Omnipod?
Yes, Medicare beneficiaries really important constituent for us, I'm sure, like everyone. And our team has been working tirelessly to increase access for Medicare beneficiaries, along with obviously others. We, in fact, do not have any delayed DASH launch into Medicare. So there are many Medicare beneficiaries who have already started on DASH. So we aren't limiting supply of next-generation products for Medicare beneficiaries. It is a challenge, though, with any new product launch and demand is high, just making sure that we're focused on driving increased access across the board, because that is the limiting factor for DASH adoption. It is about how many payers are covering it and how accessible and affordable is it for users. It's one of the reasons why we changed the business model for DASH and why we eliminated the upfront cost of the system. We want the broadest access possible, and we want the most affordability and the most availability for the products. But today, Medicare users have access to DASH.
And I assume then the follow-up question was, and you would assume it would go as well for Horizon.
That is the plan. Yeah, absolutely. All of the work that we're doing today to establish access for DASH should port right into Horizon availability.
So Stacey, not me, asked this question. I have to be clear on that. DASH pods under DME, durable medical equipment, instead of or in addition to pharmacy. Now, I don't know if this is a question, Shacey, that you can answer from your side or if this is something that insurers and payers deal with individually. I think she's asking, can I get the DASH pods under DME?
Sure, yeah. A very sophisticated question from your user who clearly understands how these different pathways for reimbursement and access work. But DASH is actually available currently through both the pharmacy and DME. But we are still building broad access for DASH, so there are some limitations. And she's right that we focused on the pharmacy. And there really were two things that happened to prompt us, Insulet, to focus on driving more DASH access through the pharmacy. The first is that last year, CMS, the Centers for Medicaid and Medicare Services, formally designated Omnipod as a pharmacy or Part D product. So for Medicare and Medicaid, we really have to be in the pharmacy. And actually, where our customers were accessing their Omnipod through the pharmacy, the experience was just really great. It was much more consistent in terms of out-of-pocket costs, often lower out-of-pocket costs. And customers could just go to the pharmacy and get their pods when they picked up their insulin and other supplies. So that was number one. And then number two, we also decided, as I mentioned, to help, more people be able to afford and try Omnipod to eliminate the upfront cost of the system. And that model where you don't have an upfront cost for a durable medical equipment and you just have these ongoing disposable costs, that's really unlike any other tube pump that's covered through DME. So just the business model itself fits better into the pharmacy than it does into DME. But ultimately, we already do offer Dash in both channels, and provided that the DME provider or the pharmacy partner will accommodate our pay-as-you-go model and work with us to eliminate the upfront cost for users, we will move it through both channels.
Another question that came through, and this may have already passed, so certainly let me know. But Jill said, when will the Omnipod View and Omnipod Display apps be available? Omnipod customer service told me they were released already, but I can't find them in the App Store. Are those out?
Yeah, so great question. So no, the apps are coming actually probably in a matter of weeks. They're in limited market release right now. So there's a subset of users, our beta users, that are testing and making sure they operate as we expect. But the feedback has been fantastic. And so what we had communicated is that they would be available this summer, and we're still on track for that. I think they'll launch at the end of this month.
And to be clear, what do those apps do? What are those apps?
Yeah, so Omnipod Dash, because it's a Bluetooth system, enables really three capabilities. The first is Omnipod Display, and the Omnipod Display app allows users to basically monitor their PDM data on an app on their smartphone. So it tells them, how much insulin left on board, when was their last bolus, last BG, all of that data that they would normally have on their handheld PDM, they have on an app on their phone. And then Omnipod View allows parents and caregivers to monitor their loved one's diabetes more easily with a remote app. So if you're an Omnipod user, you can invite your parent or your spouse to follow you and your Omnipod data. And then the last piece is an iOS Today widget, which is on your iPhone, you can view your Dexcom data and your Omnipod PDM data in one snapshot without having to go into an app, just on your mobile phone.
Sounds wonderful. I love the idea of having pump information, being able to share, not just the blood glucose.
That kind of completes the picture, right? Because you know what's happening. You just don't know if your loved one has adjusted their insulin accordingly. So this gives you that snapshot.
You say it so nicely. In my head, I'm thinking of my son going, "Mom, I bolused. Enough." Right? You can see it.
Well, funny because I follow my father, who uses the pod, so I'm in the same boat.
Yeah, let's talk about your dad. You've spoken publicly about this. I was just reading on an article in Beyond Type 1 that your father is doing much better with his diabetes since using Omnipod. Do you mind sharing some of that story? He lives with Type 1, right?
He does, yeah, for 45 years now, believe it or not. So I grew up with type 1 very much in our family. And, it's a different time then. We didn't have the technology that we have today. We didn't actually even have BGMs when he was first diagnosed. And so he was not as well controlled and certainly not as empowered and educated about his disease and potential technologies out there. So it took me forever. For many years, I tried to convince him to get onto pump therapy, but he just never wanted to wear something on his waist and be connected via a catheter. And he just had a lot of resistance to that, frankly. And resistance, I think, to even just acknowledging the disease and the control that it had over him and the impact that it was having on our life. So it's one of the things that attracted me to Insulet. One of the reasons I joined was because I saw the potential in Omnipod to help more people get access to pump therapy and get the benefits of continuous subcutaneous insulin infusion without having to have the cost and the complexity and the visibility associated with tube pumps. And, technology, there's different strokes for different folks, but there are many people out there, the vast majority of people living with type 1 diabetes still rely on multiple daily injections, and many of them could benefit from improved control and all of the long-term benefits that brings in terms of reduction of morbidity and mortality if we could get more of them onto pump or pod therapy. And so that's the potential I saw, and it certainly played out that way with my father. He's been a proud podder now for 4.5 years, and just, raves about what a difference it's made for him, and it certainly gives me peace of mind.
What's the dynamic like, though, I have to ask? I think we're very familiar with parents following kids. When you're a kid following your parent, what are those conversations like? Do you guys talk about this is a good time to call me if you see this on the CGM or you see this on the Pod app, or really it's time to leave me alone because I have it under control? Can you talk a little bit about the dynamic, if you don't mind?
Yeah, I think it's probably very similar, particularly because, I am obviously well-informed and well-resourced in this area in terms of really understanding the technology and how it works and how it could bring benefits. And so it's probably a pretty similar dynamic. He's referred to me as the diabetes police before, and I do take a pretty active, educational role with him. But, it's also he can see very clearly the benefit that it's brought to him just in terms of his A1Cs, in terms of no longer having lows that he was having, and being aware now more of his trends and how the data connects to how he's managing. So, he's become much more active and engaged than he was before. And so that's been helpful. And so I would say, less diabetes police these days and more just sort of a friendly discussion about how it's working or not working for him and what we can do to continue to try to make it work better.
It's so interesting. It's interesting, too, to think about how many more people are going to be helping their parents with all of this technology. I mean, it's a real change. If you think about someone who's lived with diabetes for 50 years and decides that they'd like a pump or they want to try a CGM, then these conversations, really start changing. All right, let me go back to my listener questions because there's still quite a few here. Actually, let me give you a compliment. So Katie writes, your tech support is really kind and helpful. I don't dread calling them like I do some companies. Please don't outsource to save a few bucks. I wasn't sure whether to read that or not, but at the same time, it is an issue in our community. We spend a lot of time on the phone with insurance companies, and we spend a lot of time ordering stuff and dealing with things. Can you talk a little bit about, I'm hoping that experience is the same for everybody, but, manufacturing here in the United States, are you keeping that? Are you keeping your customer service in the U.S.?
So, yes, we have both now manufacturing and customer service in the U.S., and it's wonderful to hear that feedback. I actually think that feedback is a great ringing endorsement for our culture, because what we say at Insulet is always that regardless of where you work in the company, whether you're on the line in our new U.S. manufacturing facility or in finance or in other parts of the world, every single individual who works for our company is responsible for our mission to improve the lives of people living with diabetes. So I would hope that actually any individual that you interacted with at our company would garner the same response that your listener just shared about our customer service team. But we don't really have plans to offshore that. But I think the corollary to that is it's an incredibly expensive market to serve. And so trying to figure out how do you do that, we look to systems and other technology to really help us drive an improved customer experience and hopefully contain costs as the business grows. But I certainly don't want to provide a different customer experience, because part of the burden of this disease is not just technology and insulin delivery, it's also access and customer care and all of the things that come with it. And we believe there's opportunity to drive improved experience and reduced burden across all of those aspects of managing diabetes.
There were a lot of discussions a couple of years ago about skin rashes, especially from Dexcom, frankly. And that seems to have cleared up quite a bit. I know I've talked to them, and I know they've changed a lot of their formulary, and so fewer people are getting any kind of reaction. But Christina wrote in and said, my son still gets bad rashes from Omnipod, but he doesn't with the Dexcom. Can you talk about that? And she also wanted to know if the pod itself may become any smaller or thinner in the future. Can you speak to any of that?
Yeah, both great questions. I think, the adhesive with Omnipod is a medical grade adhesive, but with every company who has a wearable with adhesive is faced with this challenge, because what we're doing is we're always balancing stickiness and durability of the adhesive with sensitivity. And so there is a small percentage of people who have some sensitivity to the adhesive. And it's funny because I hear people who want it to be stickier and others who want it to be gentler. And so we're always working to sort of strike that right balance that will work for everybody. We are always making product improvements to that front and have lots of tips and tricks from users and from our clinical community. So I would encourage her, if she's an Omnipod user, to contact customer care and may be able to help her with that. And actually, for those, it's funny because my father retired to Alabama, and so he's a big golfer. And this time of year on the golf course, he has the opposite problem, which is pods not sticking the way that he would like it to. And for that problem, we did recently launch a product called Pod Pals, which is an adhesive overlay that helps keep the pod in place. So we have those types of solutions too. And in terms of the size of the pod, no immediate plans, but I will tell you that that is one of the things that we are constantly exploring is footprint and profile. There are, in the pod, there are 72 components and just an incredible amount of sophisticated technology nestled into that current footprint. So it's not an easy task, but we know that those are things that are incredibly important to our customers, and so we are always have kind of early stage research and development work going on in that way.
Can you just repeat what you said? Is it a Pod Pal, P-A-L, the sticky thing?
That's right. And I can have Natalie or somebody on our team send over a link to that. Those were launched just recently, but it's a great solution for summer months or intense activity, anywhere where you're sort of hot and humid. It's a great little product.
Excellent. A couple of minutes ago, you mentioned access. And we've been addressing cost and things like that throughout. But Phil specifically wanted to ask about the debate about the cost of insulin. Now, obviously, it's not specifically and directly about Omnipod and medical devices, but he wondered if there were any implications for medical devices like the Omnipod.
Yeah, it's an interesting question. I think ultimately we all believe that diabetes and people living with diabetes, the choices around technology and medicine should be shared by the individual and their healthcare professional. And, you look at what's happening today, technology is evolving faster than ever. And so we need to make sure that people have access, affordable access to these technologies and these new tools to manage their diabetes successfully and to stay healthy. So ultimately, cost and access are critical for people with diabetes. And that's not just about the technology, but that's also about the medicine. And it's why, we've worked to launch some tools, non-branded tools, websites and other support systems to be able to help people be empowered and raise their voices and express concern or a need on the access front. It really is a challenge, and it's why when we think about DASH as an example, why we worked hard to innovate with that system, but also to eliminate cost with that system, because how much people are going to have access to these technologies comes down to, how broadly covered are they and can somebody afford them?
All right, so I'm a little embarrassed to ask you this question, but as an outsider to the Omnipod system, you must know that one of the things that we who do not use it know about Omnipod is that people hit them with hammers and put them in the freezer when they scream. And I asked my listeners about this, and it was about 50-50. Half the people said, that so rarely happens. Don't ask about it. It's so rare. And the other half said, oh my gosh, that happened to me 3 pods in a row. Please ask. I mean, why does it do that? Obviously, it means there's something wrong or it's alerting you. But are there any plans to make them easier to deactivate?
So, yes, we do know about screaming pods. It is, at least when we look at the data, it's an incredibly rare occurrence. So I'm sure it's frustrating, but it is very rare, and it is a safety alarm. The good news is it's actually really pretty simple to deactivate a pod. So the best trick is, if you need to silence a pod, is to just flip the pod over and pull off the adhesive backing. And along the back edge, you can just use a paper clip or a pin and poke the little clear hole to the right of the gold circle in the middle of the pod. That is literally all it takes to deactivate and silence that alarm. So it's actually pretty straightforward. For some reason, it seems not broadly known. So actually what might be great, Stacey, is if we can have our team send over those details and you can post them for your users, because it is a pretty simple process. Okay,
well, I'm going to ask a dumb question then. If it's an alert, why not make it something you can turn off from the PDM?
Yep. So there's a difference between an alert and a safety alarm. And this is, whatever prompted this is a safety alarm, something that we don't want the user to be able to dismiss. We want the user to deactivate the pod.
Got it. And that's a great differentiator. Thank you for talking about that. Because I always wondered, why can't you just click it off? Okay, that makes a lot of sense.
Yeah, for most alerts on the pod, you can just dismiss them, but they may reoccur if you don't do something about it. But for this particular one, it was something that we want the user to deactivate the pod.
We've all turned something off, and then 10 minutes later, it's gone off again, or we've forgotten that we turned it off. I get it. So One of the big news stories that has come out in the last year is Tidepool, this company working to bring Loop, to bring the capital Loop, capital L Loop to market and kind of ushering it through the FDA process. And Insulet was announced as the first company they're going to partner with on this. I think it's fantastic that you all are doing this. The interoperability is something that many of us are really keeping an eye on. Can you talk about why this was important to you? I mean, you have your own Horizon hybrid closed loop coming out. Why partner with Tidepool on something that's different?
Well, we actually engaged the DIY community to learn from them as part of our Horizon development program. So obviously there's a tremendous and growing user experience out there by this sort of motivated and tech-savvy part of the community. And so we engaged that group to, just help us learn from their experience as we developed Horizon. And it was for us a great opportunity to sort of support that community and work to get their algorithm and their system studied and cleared by the FDA and then commercially supported. So at the end of the day, we fundamentally believe in interoperability. If you look at Omnipod, it was very much designed to be an interoperable system. It's one of the reasons why we want to get to the phone because, if you think about the average user, regardless of the sensor that they're using, they're scanning their Libre from their phone, they're, viewing their Dexcom data on their phone, all of their Fitbit and, various nutritional apps that they use are on the phone. All of that data over time, I think, can be helpful. And there's not going to be one solution for millions of patients. And so we believe that our job is to, develop the best insulin delivery system, and then users should be able to use the algorithm, the sensor that they want. And clearly there was enthusiastic, passionate demand on behalf of the DIY community for Loop and for this effort. So we were actually really happy to support them. The other benefit to us is that it could be the first iOS platform available with Omnipod because Horizon will launch with Android. And when Loop is approved, it's an iOS app as opposed to an Android app. So that should help us, get phone control to more people more quickly. And then obviously we're thrilled to work with the DIY community.
Would Horizon and then Tidepool Loop use the same pods, or are there different pods that would be used?
We're still evaluating that. There's a possibility that it's the same pod.
As someone who was an Animas customer and kind of saw that go away, I think there's always a concern that whatever I'm using, like the Dexcom G4, that some people are still holding on to because they wanted it for their older pump, that the actual hardware bit may go away. So I think
right. That's another great reason, frankly, to go to the phone, right?
Yeah.
Rather than having to wait for these hardware cycles to update and people's lock-in periods to expire. When you go to the phone and you don't have the capital, you can with the pod, right? It's just about the pod, which is a disposable 3-day device. So that's why we worked hard to kind of get people out of that lock-in cycle because you want, as you bring new technology to market, you want people to be able to adopt it and benefit from it.
I guess, and not to belabor the point, but what I mean is, sure, it's on the phone, but you need, to use the Dash, you need the Dash pod, right? It's not the same. With the Horizon use the Dash pod? Am I even saying that right?
The Dash pod and the Horizon pod will be the same pod.
Got it. As we move forward here, so, let's say everything is in a timely manner, and then we get Horizon and we get Tidepool Loop with Omnipod. What's your long-term vision for where Omnipod and Insulet will be in 5 years, or in 10 years? What are you building toward?
Well, I think this is just an incredibly exciting time for our community. Technology is advancing really rapidly, and consumer technology is merging with medical technology to make things easier and kind of more intuitive. And so when you think about where this could go, things like machine learning and advancements in algorithms and advancements in technology, the goal here for us at Insulet is just to eliminate more and more burden for people with diabetes. So you think about the next 5 to 10 years, our mission to make diabetes a smaller part of life for our users and continue to remove that burden and those frictions. In our minds, that's everything from the cognitive burden of dosing insulin and managing insulin delivery to how you get access to the technology and how you get connected to clinical and community support. So I think when we look over the next 5 years, our goal is to help more people living with diabetes just live longer, healthier, happier lives.
Shacey, thank you so much for talking to me for this first time here. I hope it's the start of many more conversations. I really appreciate it.
Yeah, it was great to meet you, Stacey. Thanks for the time.
You're listening to Diabetes Connections with Stacey Sims.
Lots more information about Omnipod and the subjects that Shacey and I talked about. You can find all of that at diabetes-connections.com. There are show notes, and I talk about show notes all the time if you're not familiar. This is a summary that goes with every episode. You can click on it on the website. You can find it if you're listening in a podcast app. Sometimes it says more details here or more information. It can be a little tough to find, but it should be there. If not, you can always go back to the homepage and track it down. As the technology changes, the interest is so high as these systems are coming out and we're seeing the timelines, and it's an exciting time. So I know you want all the information, and I will do my best to get it to you. Our community connection this week was a place that had a lot of this information, the American Association of Diabetes Educators. They had their big conference. And one of the things that came out of this really had nothing to do with technology, but was more a way in which the role of educator is being defined. So this sounds like a little thing, but I thought it was very interesting that they have renamed what they're calling their membership. So AADE has always gone with CDE, Certified Diabetes Educator, right? We kind of use that term. A lot of us will just say CDE or our educator, but the AADE is changing it to Diabetes Care and Education Specialists. So I started asking around because I thought this was very interesting, but I was a little confused as to what this means in terms of referring to them. It doesn't sound like a big deal, and I'm not sure it really is, but when you're writing something or you're talking to your endocrinologist, are we supposed to now change from saying CDE? So I posted about it in the Facebook group, and thank you to Dr. Stephen Ponder, who wrote back that no, CDE is a credential owned by the National Certification Board for Diabetes Educators, which is a 501c6 organization. And he was the former chair of this organization in 1996. So thanks, Dr. Ponder, for that. So your CDE will still be called a CDE, except for when that person is a member of AADE. I don't know. I thought this was pretty interesting. So it's a very tiny thing. It was one of the things that came out of AADE that I thought was interesting, and I will certainly be following up on. There wasn't any kind of breakthrough big announcement as there has been in years past at AADE, and I'll pass along if anything kind of comes through that we've missed. But in the last couple of weeks, did get an update on a couple of things, so I'll pass them along here. Baqsimi, the nasal glucagon, is available at more and more pharmacies. It was available at my local pharmacy more than a week ago now. So you have to check with your doctor first to get a prescription, but you also really need to check with your pharmacist because there are coupons. So make sure, as Lily has said, if you have commercial insurance, this should cost you $25, way down from the list price. So definitely talk to your pharmacy. Make sure you get your coupons for that if you're interested in the nasal glucagon, now available at more pharmacies and rolling out across the country. And the other news that came out that you may have missed was that Tandem submitted the Control IQ software to the FDA. It's in the FDA's court now. Who knows when exactly it will be approved or if they'll want more information or what's going to happen there. Time for Tell Me Something Good. Yeah, my favorite part of the show each week. And I love this story from Real Good Foods. They are low carb, high in protein. They are adding more and more varieties of food all the time, and they're really great people. This whole thing started with the diabetes community when the CEO got a letter from a 9-year-old with type 1. And he was so happy. He had this really yummy pizza that didn't spike his blood sugar. His parents were happy. He was happy. And it only had 8 carbs. Real Good Foods isn't a diabetes company per se, right? But that letter made them realize that they wanted to do more in our community. So I'm thrilled to have them on board with the podcast now. And we are such fans of their food. The pizza, the poppers, now the stuffed chicken. They make breakfast sandwiches. And it's all in the grocery store freezer, which is great. If it's not in your local store, check them out online. Find out more at diabetes-connections.com and click on the Real Good Foods logo. All All right, checking in with you all, sending me your Tell Me Something Good stuff. Andrew wrote in, we nominated my son's school for a Diabetes UK Good Diabetes Care in School Award, and they received it. They have done an excellent job with him. They really deserved it. Secondly, Jamie did a JDRF Fun One at the end of June, and he raised about 780 pounds, about $975, Andrew says, for JDRF. And he included some awesome pictures of his son. I mean, Jamie is just adorable here, standing with the school trophy in what looks like a little school uniform. And then at the run, sweaty and smiley and really just looking proud. So thank you so much, Andrew, for sending that in. Great stuff. I want to say a big congratulations to Charlie and Mike, who celebrated the birth of their child earlier this month. And I know Charlie, we've met in person, but I know her mostly through social media. And she's been posting her journey because she was on bed rest. She lives with type 1. And she posted that they made it 35 weeks and 2 days, 4 pound, 4 ounces, little guy, born on August 13th. So congratulations to you, Charlie. I hope you got that banana you were jonesing for in the hospital. She kept asking for bananas and they wouldn't give it to her. No dietary restrictions. I think they just kept forgetting. You know how it goes in hospitals sometimes. But the most important thing, healthy baby, healthy, happy mom. We're just so thrilled for you, and I wish you and your family all the best. A little bit of a selfish Tell Me Something Good. I spoke about the Myabetic Diabetes Awards. Those are still going on. You can still vote. I'll link that up, as I probably should be doing more self-promotion. But I was also really excited to tell you that we have made it to another competition, the Independent Podcast Awards. They're called the Podcast Awards, The People's Choice. But they are for what I would call independent podcasters, right? Not NPR or a replay of your local radio shows that you might have podcasts for. These are shows like this, produced by one person and, sent out into the world and doing the best that we can, and not affiliated with a big network or anything. And for the 4th year in a row, for every year we've been eligible, we've made it to the top 10 for health. So thank you for voting for me. There was a little bit of a nomination process in there, so I know some of you did that, and I appreciate it. But they still will have the final judging. All I really wanted to ever do was make it to the top 10 in this one. So that's just amazing to me. And I really appreciate it. So thank you all. And that's my Tell Me Something Good. Thank you so much. If you want to get me your Tell Me Something Good stories, I usually throw a post or two up every month in the Facebook group. But you can also email me, Stacey@diabetes-connections.com. And man, as I'm saying this, I got to get on Instagram more with Tell Me Something Good. So look for that. I will try to put that out in the next week or so. Tell me something good. As this episode is airing, I am just back from JDRF in Central Virginia. Went and spoke to the folks there. Always appreciate you having me out. And I've got another Type 1 Nation Summit coming up in September in Houston. October looks like it's going to be Friends for Life in Falls Church. And then I'm going to a podcasting convention. I'm so excited about this. I'm going to the first ever women's podcasting convention. It's the She Podcasts Convention. And then in November, I'll be here in Charlotte at the Take Control of Your Diabetes Conference. TCOID is coming here for the first time. Thrilled about that. I'm rattling that all off to say, get to the point, Stacey. If you'd like me to come speak at your event, please reach out. The calendar is filling up. And with the book coming out in the fall, The World's Worst Diabetes Mom should be in my hands in mid-October and then out for the public and on Amazon right at the beginning of November. So I'm going to be really doing a lot of speaking and traveling for the book. If you'd like your JDRF chapter to have me for their Type 1 Nation Summit, or if there's another event in your area, please reach out. Love to come and meet you. Love to talk about making diabetes connections in real life, or what makes me the world's worst diabetes mom and why you should be one too. We'll talk about that. But please let me know. I love meeting people in person. I love bringing the show to you. And it's really easy. In fact, the new website, diabetes-connections.com, has a little toggle thing called Community. And I will actually promote this more in the Facebook group. I don't think I've put it out there yet. And it's got a form. It's got a really easy way. Hey, come have Stacey speak. Here's where she's going. Here's where she's been. Really easy stuff right there on the website. So I hope to hear from you, and I hope to meet you soon as well. Thanks, as always, to my editor, John Buchanan from Audio Editing Solutions. And thanks to you for listening. I'm Stacey Sims. I'll see you back here next week.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.